Welcome to the second video in
Part
our
2
series of being YouTubers,
series.
which I feel like you have resisted for a while.
I just get quite scared by the concept of adding another platform
Another
to
layer.
our to-do list.
Yeah, that's why I feel like this is kind of a one-off.
Yeah.
Unless you really love it and we become really rich and famous, and then this could be
Maybe
our
we'll do
full-time job.
YouTube instead of podcast. Maybe that'll be easier.
Oh, you know, anything would be easier. So we are in our part 2. We just want to talk about, we want to talk about...
don't minimise my topic. Had your spotlight.
We want to talk about therapy, counselling, psychotherapy, seeking help, and how, if you are within a emotionally versed network on the internet, you probably think everybody in the world goes to therapy.
And their dog.
And their dog goes to therapy, especially as, you know, a middle-class white woman feels like everyone's going to therapy these days.
My whole Discover page is just like either quotes from therapy or videos from therapists.
Mm-hmm. But I think what we want to do in this video is remember there is still probably a majority core group of people to whom therapy is this like unavailable pit of doom.
Pit of doom.
I honestly, like,
Yeah,
that's
to
kind
be
of how I
fair.
felt.
Yeah, no, I get
And
that.
I think it's often the thing when someone very close to you shares a real issue that's been going on for a long time. I feel like, you know, a lot of conversations I have get to this point where I'm like, shall I mention it? Shall I not? Shall I mention it?
What, to tell them to go to therapy?
Yeah.
That's the thing, I don't know how to tell people to go.
I don't tell people,
I'm
but
just like, have you thought about...
have you considered, like, maybe seeking some help for this or whatever? Yeah. And then it's really interesting because people either will look at you like...
You think they're crazy.
Yeah, either that or like, I would, but like you can see that there are all these kind of like
things,
blocks in the way mentally and like in terms of stigma or whatever that are like stopping that path, or like, I don't know, the stigma or just not feeling ready to like open that path, or that it's too expensive.
Yeah.
But I think in this video we should talk about that. Yeah. Just that whole thing. I feel like we have probably said too easily, just go for therapy.
Yeah, and we are lucky. We're very privileged to have been able to, not only to have got like access to that, but also for it to have been normalised in our lives from an early-ish age.
Was it?
Well, I don't know. When was the first time you went to therapy or some kind of counselling?
So this is where I feel like I kind of got to the point of like no choice because it was such a crisis.
Okay.
And that's the issue with, I think, maybe people not thinking they're bad enough.
Yeah.
You know?
Sure.
So I think for me it was more like, I did know my dad had gone to therapy when I was a young child, so I knew that.
Was it hush-hush?
It was hush-hush, and it was also a bad experience for him, sadly. So I think there was kind of, all therapists are like this person, a little bit.
Yeah.
What about for you though? When did you first hear about therapy?
I think I went at like 16, 17. I had some counselling in school. Okay. But it was like my friend's mum.
Oh, Lord.
Really unprofessional. And then I went to a counsellor at Guildhall, and then my first music college, and then my second music college. And then I paid for a therapist outside of music college. I don't know, I've just kind of always been in therapy or some kind of counselling.
On and off kind of thing, yeah.
So for me it's very normalised, but the stigma hasn't escaped me. In that I think their main stigmas are, people don't think they're bad enough to go, so they wait till a crisis point, or they, as a byproduct of that, they think that everybody goes to therapy is in crisis, or they think they're not worthy of spending that money or time on themselves.
Or someone else needs it more than them if it's, say, through the NHS or something.
So it's either that you're not bad enough or you're not good enough. But then there's the stigma of, I don't know, because it's kind of like a hidden away, like you go and see somebody that you don't know in this room, and it's got to be really secretive and confidential. So it seems like the whole aspect of it seems maybe, I don't know, that the concept of it being behind closed doors and secretive makes it maybe seem more taboo or stigmatised. But actually, the confidentiality comes from, like, builds trust rather than suppressing secrets, which is, a whole nother thing that I could talk about for ages. But also, particularly at the moment where everything is so expensive and therapy is expensive, and it just feels like, well, why would I spend that on these things when I could spend it on food or rent? Or you can always find an excuse, or there's not enough time, or, like you said about the NHS, like there's going to be somebody worse than me that needs it, and the NHS is already under strain or whatever in the UK we're talking about.
I think the other thing that's happened in my life is that my family will have seen all this therapy I've been to, and then there might have been a break of a few years, and then I might mention going back, and it'll be the thing of like, but you've already done that.
Yeah.
Surely you've done it, like you've talked about enough now.
Yeah.
Surely you can use the tools, like.
And some people, especially in a family situation or a relationship situation, may see you going to therapy as a threat to your relationship. It's what are they not getting from me that they need to seek from a therapist? Or particularly, I imagine for parents, it's like, have I not done a good enough job parenting them? Or when in actual fact, I don't know, I think if people have been raised in a way that they then want to go and seek therapy for themselves, that shows an amazing emotional self-awareness or vulnerability and kind of drive to look after yourself. The default shouldn't be
to learn about yourself as well.
Yeah, exactly.
Yeah. I'm really interested though. So now Rebecca is in her level 4 of a counselling diploma, which goes from level 2, which is a year, level 3, which is a year, now level 4, which is 2 years. So you're in the 3rd year of a 4-year journey to becoming a qualified licensed psychotherapist.
It's not a psychotherapist, it's a person-centred
counsellor.
Either therapeutic counsellor or therapist. There's so many terms for it, and this is what's very confusing.
Yes.
And I wanted to address.
Nice.
That, because like people are always saying, what's the difference between a counsellor and a therapist? And in most respects, there isn't any difference. It's just about the theory or the school of knowledge that you are being trained in. So if you are being trained in maybe CBT, cognitive behavioural therapy, or did I say behavioural? Anyway, doesn't matter. Or like psychodynamic, which are 2 different kind of theories, then you might be more likely to call yourself a therapist, whereas person-centred counsellors will probably be more likely to call themselves counsellors. There's kind of no difference in terms of if you're seeking support, don't be put off if one's called one thing and one's called the other, unless you're looking for a specific. If you're looking specifically for CBT, then if somebody says they're a CBT counsellor, that's fine. Like, just look out for CBT. But then there's also like psychiatrist and psychologist, which are in...
It's a much longer road to becoming...
Yes. And they're in the medical profession, generally. So they will generally have gone to medical school or done like a psychology degree or something like that. And a psychiatrist in particular will be able to diagnose and give medication, whereas counsellors and therapists are not qualified to do that. So generally their counsellors and therapists are working from a more holistic, humanistic...
Working with you and like
helping
you to help yourself.
Trying to find the underlying causes of the symptoms, whereas somebody working in psychiatry is more likely to give you medication, and then you might also have some counselling on the side to kind of figure out what's going on underneath. Is generally, but there's so many, it's such a great area, and there are so many different routes to becoming any one of those things. Like even to be a counsellor, I found it so hard to find a route, a progression to be like, okay, I need to do this, then this, then this. It's like,
and then even in this country compared to like the States or whatever, like not that you'd need to counsel in the States, but like
I can't be asked.
Like a lot of the information online and like YouTubers and that are from the States, so it's just like whoa.
I think the main message is don't stress about the different terms. We can talk about finding a therapist as well, but like. Just counsellor or therapist, you're probably not going to go wrong specifically between those terms.
We love it.
Yeah.
So from in terms of why, going from your own therapy experience, you wanted to become a therapist, for people that haven't, I guess, had that feeling or had that, support of being in therapy, what was it about that space that then led you to be like, I want to provide this space for other people?
I think for me, I mean, I've had therapists that I didn't think were that effective for me, and I've been to lots of counselling that I didn't think was any good for me. But when it has been good, it's been amazing. It's totally transformed my life and my view on life and my view of myself. And having that, say it's an hour a week or every fortnight or whatever, to not worry that you're talking about yourself too much. Like, your therapist isn't waiting for a turn to have their say about their week. Your therapist doesn't know anybody in your life, so you can say whatever you want about them. So you can actually be really honest. You can be honest about your own feelings to a point that you just can't anywhere else. Even though I have the most loving relationship with my partner and I have the best friends and whatever, there is still... It's never a relationship out of the context of your life like therapy
Without bias
is.
or context of them, of who you are and where you know, of how they might relate to you or how they might seem to you, or
Exactly. So that having that space was such a positive transformational force in my life that I wanted to provide that for other people, but with the support that a therapist or a counsellor might have. So you have like supervision where you fortnightly or monthly go and talk to somebody about your cases and just get advice, or they just kind of keep an eye out on you as well. And you might be working under an agency, so you have other people. I don't know, like, I just found myself wanting to give that help to other people in my own life, but feeling like I wasn't able to do so, or like burning out, or that it was just too much on me. And also I found that in my career as a musician, I was wanting to kind of give something to people, but I think particularly in the way that the arts are supported or not supported in the UK and funded, that I wasn't actually able to do that very often through even outreach or anything. Like, it was so sparse and not very well done that I don't feel like my music is very a generous act. It feels very selfish.
That's so true.
In some ways.
Because it's so easy for people to be like, oh, if you want to give, just give, play for old
or
people.
Teach, or I don't know. It just doesn't feel like...
This is more in line with your experience and like you and your gifts as a listener.
Yeah.
I guess you could put that in a musical way, but you're already doing that in a musical way.
Yeah, and also for me, I think it's really important I have something outside of music to give me a bit of a break and a bit of perspective, which is ironic because it's not going to give me a break because I'll be dealing with some really big things through therapy, but I actually find it very fulfilling and very energising.
It's funny, isn't it? No, I was going to ask that. Obviously, you haven't done so much work in the therapy room or any placement work.
No placement work yet with actual, like, real people.
Yeah.
Only with peers in my class.
Yeah, but I guess you can still understand, like, how that space might feel from the work you've already done.
Yeah.
Like, is there a sense of you worrying that you will take their stuff with you, like, outside, or like that you'll feel ground down by the work, or like what is it about it that you think is able to be quite fulfilling and not depressing?
There's a lot of training and a lot of support to help you
Think about that.
to kind of preemptively deal with that. So whether it's making sure you're in your own therapy and making sure you have such a solid sense of your own stuff that when you're trying to empathise with people, that I think there's an amazing quote that I'm going to completely misremember about empathy from Carl Rogers, the guy who kind of established the person-centered therapy, about empathy being entering into somebody's own world to see it from their perspective without losing a sense of your own world.
Oh, I love that.
And you have to be so...
You're not giving everything to...
You're not losing yourself.
Right.
You're seeing it from their eyes.
Oh my gosh,
empathizing
wow.
from their perspective without getting lost in it.
Wow.
And I think that's really helpful for all. I mean, you could say that about, you know, making sure that your work-life balance is good, or like, you know, teaching people.
Oh my gosh, boundaries in general, actually.
Exactly.
I suck at them.
Yeah. And I feel like most of level 2 and level 3 in the counselling was about boundaries and that kind of stuff. So there's that. But also, if you're feeling ground down and tired and not present or not able to be present with the client's problems, then you're no longer fit to practice. So that's a really serious thing.
Wow.
So you need to really do the work to make sure that you don't get to that place.
Or to be really in tune that you recognise that risk and when it's coming or whatever.
Which I think is probably a thing that we should all be doing in all of our work.
Lol.
But
yes.
we don't, because we live in a capitalist society.
We want to be as productive as possible.
Yes, classic.
So in terms of finding therapy, and I guess coming from a space of recognising this huge fear that a lot of people have, I'm really trying to enter into that like fear understanding of people who just don't think they could talk to someone about their shit yet or ever, or, you know, because you are so exposed and not every personality is ready to feel that exposed. You know, I don't know where I'm going with this. I just kind of want to like honour that experience of like, I don't want to talk to anyone. Like, how do you go from that to like maybe being open to trying it? Is there a way of like trying but not committing?
It is important that like nobody should force you to go to therapy.
Okay.
Particularly in the school of counselling that I'm studying, you have to be willing to be there. Otherwise, I was going to say progress, but like movement and growth can't happen because it has to come from you.
Sure.
And no one can draw that out of you if you're not willing to give it. So I think a lot of people do feel that they're going to be very exposed in therapy. But I think it's also important to remember that a good therapist is not going to push you past the place that you're comfortable.
Right, yeah.
And if they do, maybe they're not the therapist for you. Unless you're doing something like exposure therapy, which is a completely different thing. I saw a statistic today that said 80% of people thinking about seeking therapy are not open to change. Which maybe
that's really scary.
Is scary, but also you got to think about, okay, but what is it that you don't want to change? Like, and why is that scary? In terms of seeking therapy and having no commitment, a lot of therapists will say, you know, come in for a session, we'll see if we click, or like you will have a session before you draw up the contract.
Sure.
But even once the contract has been made, it should be a negotiable thing so that you should be able to terminate it at any time. And that is part of you going to therapy. You are the client. It is your work on yourself. It is not the therapist's job to try and hold you and keep you. Yeah. Even though it's, you know, the income that is part of our training is to be like, you know, this is not about us.
That's so hard.
It is hard. I would, you know, I was going to say I would advocate for everybody trying it, but in some instances people sometimes aren't ready to talk about their stuff, and that's okay as well. But I think recognising that it is something that you would be willing to do in the future is really strong as well. And there is support out there that's not therapy. You could go to like a peer support group or some kind of group where you just hang out with people that are going through the same thing, but you don't necessarily talk about it.
Yeah.
Or connect with people online, or just be in a Facebook group where people are talking about things that you resonate with, but you don't have to contribute.
Or Reddit.
Yeah, Hattie.
Or not Reddit.
Maybe not Reddit. I don't know.
I actually deleted Reddit the other day.
I didn't know you were a big Redditor.
I'm not, but like
I don't know, I feel like this is a
every
side
now
of
and
you.
again.
Yeah, yeah.
Every now and then I'll do a little dabble in the old Reddit.
How's that for the old compulsions?
Yeah, terrible. So anyway, what was I going to ask? Yeah, I think in terms of low cost therapy,
Yes.
from your own kind of research, what are the options out there in terms of someone, you know, either in crisis or actually maybe we should talk about not crisis. Maybe we should talk about like, I know I've got stuff to deal with. I know I've got trauma to deal with. I don't think it's bad enough, but I'm poor. You know, if I came to you with that, what would you say?
It's a tricky one because I think we undervalue ourselves and our issues. So I think a lot of the time, yes, therapy is money, but you're worth that money.
Ooh.
However, I also recognise that is a very privileged thing to say. So there are low cost options out there. I mean, there are free options like the NHS, but the waiting list is obviously
And they tend
dire.
they tend to be less kind of philosophical styles of therapy, don't they?
It's usually CBT, and often you have to have I was going to say a reason for going, but like something that's kind of serious, like maybe you've had a bereavement or anxiety or something, or maybe you'd be referred by your GP because they've given you some medication or something. So it's not always the best place to go, I think, if you're a bit apprehensive about viewing yourself as bad enough for going already, because I think it can feel like you have to justify your needs. Low-cost counsellors, there are some counsellors that do operate on a sliding scale anyway, particularly more nowadays. So you might go onto something like, is it Psychology Today or UK Counsellors, or just type in like therapist near me or whatever. If you want to do it in person, that's another thing. A lot of low-cost options are online.
Let's not get on to BetterHelp today.
Maybe not. So maybe avoid BetterHelp if you can. Also, just so that your therapist gets paid properly and ethically. But yeah, so a lot of stuff is online, which I've actually found with the right therapist has been great. But you also, low-cost counsellors may also be trainee counsellors, which a lot of the time, if you get one that you click with, are just as good as a qualified counsellor, and they all have the same support systems in place. It's really about who you click with as a person, which is frustrating because how can you tell that from a website? But that's life. There may also be things like agencies and charities for specific concerns or communities. So say you identify as LGBTQ, there might be a charity near you that does low-cost counselling for your community or from different races or people's
addiction or
like cancer patients or whatever. So it's really worth
exploring.
Yeah, if you have something specific, like researching through that lens, for sure.
Also, religion can be a thing for people. It's not always great to like, you know, I found it quite beneficial as a Christian not to have a Christian counsellor. Because I kind of needed that separation. But for some people, they need that like empathy of their faith, and they need, you know, safety of talking about God or talking about Allah or whatever.
And that's the same actually if you feel like something that might come up will be difficult for you to talk with somebody of the opposite gender or whatever. That might be something to consider at the beginning. And again, I think the best counsellor should be able to work with any difference or any diversity or anything that's different from them, but in the end it's not about them, it's about how you feel as
if you're not comfortable, then there's no point. So just probably a question you might not be able to answer, but in terms of the sliding scale, I've always been really curious about this. Say they have a £60 an hour fee, what do you think is like the realistic lower end of that? Like how big is that scale? Do you know?
Again, it depends on the place. I'm currently receiving counselling for £25 a session.
And that's 50-minute session?
Yeah, 50 minutes every week. Online. But
do you know what their normal fee is?
It would be something around £60.
Okay.
I mean, counselling can go from anywhere from about £20 a session is quite cheap to like, I mean, you could get like
200.
Yeah, exactly. It's ridiculous.
300.
So the other thing is that price doesn't usually reflect the quality, or not always. So if you have somebody that's really expensive, doesn't mean that you're going to really get along with them.
Say that again, because my worst therapist was the most expensive one.
Yeah.
Yeah.
Me too.
Wow. I mean, yeah.
And actually, the
My
best
free one was the best one.
Yeah, I've had free ones that have been really fantastic. And I mean, obviously, they've been paid at some point, and maybe further down the line you end up. I don't know how the sliding scale works in terms of if you have to kind of resubmit your income every year or whatever. But yeah, I mean, first and foremost, whatever suits you. If you can get into therapy and it's something you want to do, I would say go for it. Find a way.
Any final thoughts? What's the one biggest thing you wish people would know about therapy?
Therapy isn't selfish. It's not selfish to take 50 minutes for yourself a week. It can often be, I mean, aside from your own well-being, it can often be the best thing for everybody around you as well, if you go to therapy.
Okay, one more question.
Yes.
How to deal with people in your life who should go to therapy?
Oh, man.
But you feel like you then have to go to therapy to deal with them because they won't go to therapy.
I mean, what is the human race apart
Anyway, I feel
from
like this is
everybody
too
going to
confusing.
therapy to talk about other people that should be going to therapy? That's why we go to therapy, right?
This is part of healing our intergenerational trauma.
Yes, and all you can really do is take care of yourself, and maybe through going to therapy you realise that maybe you can't hang out with that person that needs to go to therapy, or you need to minimise your contact time with them.
Or you can't support them in the way you want to, or whatever.
Yeah, and how you're going to deal with being around that person and not giving them what they need because it's not suiting you.
That was a really wise answer.
Thanks, mate.
No, it was great. Actually, this has been so interesting.
But also, every therapist has a therapist. And I like to imagine there's one big therapist at the top.
One fat therapist which therapises all of the best therapists.
Nice one.
Oh, well done. I love how we're fist bumping on this one and we hugged on the other one. It's like we've gone really professional. It's like you're not allowed to hug your therapist, or you can, but kind of
depends.
Only if you lead it or whatever.
And what they do.
That's a whole other video.
Yeah.
Anyway.
You'd love to hug your therapists.
I would love to, but I never have because...
I wouldn't like to, I don't think. Where does that come from?
Honestly.
Okay,
so
bye.
Anyway, thank you for being the best. Bye. No more videos ever again.